I can see someone says, I feel ache on my right side of my hip, aches on my head, upper back, and shoulder. It is a common complaint, honestly. Aches and pains, aches and pains and women are like this. They're 5 and 6, they're together, and it's so bad. So we don't want to just normalize pain. I don't think it's right to normalize pain. So let's talk about it, okay? So women are more prone to all sorts of pains because of our makeup, because of our hormones, the fact our biological, the way our bodies work, and also some psychosocial issues, some societal expectations and stressors in our lives make pains and aches and pains even worse for women. So factors like menstruation, during menses, women have pain. In pregnancy, we have pain. From your caregiving activities, maybe you're a mom of toddlers, you're having to bend down to pick them up all the time, you have pain. Stress plays a very important role in our pains as well. So, like I said, the issue often gets dismissed or minimized. People just feel, well, just get on with it. So women suffer in pain a lot. So I was talking about my own self. I try to keep active. I do my exercises, not really gym. I go to gym now and again, but generally my main form of exercise is walking. I try to walk every day and get my steps in. Not a lazy walk. I believe walking can be very good exercise for a lot of people, but it's got to be a fast walk. You've got to walk short steps, but fast. Short steps, fast, fast, fast. And that will be more than enough exercise, I promise you, okay? So it doesn't have to be gym. So I am quite active, but what I noticed is that in the mornings, I can't getting out of bed is like lifting a log of lead. I feel so heavy around my hips and legs. I feel so much pain and ache. Even in the night, to turn over in bed is like I'm turning a box of bricks. So I was experiencing all this pain. I'm wondering what that was about. But during the day, I'll be fine. As in, I can walk around. I can do 20,000 steps during the day. I'm very active during the day. So I couldn't quite walk out while I was having so much body ache in the nights, in the mornings. So I changed one simple thing. One simple thing I did changed everything for me, and I'll talk about that in this class. So please stay tuned, stay till the end. Let's not normalize pain. It's not normal to have pain, okay? So when you have body pains, it can interfere with sleep. How are you going to sleep well if your body is sore? Even to get the right position to lie in, you turn around, you twist around, it's so difficult. So it interferes with sleep. It reduces your physical activity. Some people can't really move as they should because their bodies are sore. And it affects your emotional health. You get emotional. Women, we are emotional beings. We get emotional about things, So it affects our emotional health too. It makes it difficult to work. There's some work you feel that you can't do. I just can't do that work because I don't feel physically strong enough to do it. So it affects your ability to work, your ability to care for your children. It affects you engaging socially. There's some social things you just don't feel able to do because you're in a lot of pain. Your body is achy. You don't feel right. Either you're having neck pain or back pain or shoulder pain. There's pain in your body. So chronic pain is important to deal with because it's linked with anxiety. People who suffer from chronic pain suffer anxiety. They also suffer depression. So it's associated with depression. And if any of this resonates with you, type into the chat. I would like to know you're following. Let me know if this is making sense. So people who suffer from chronic pain often get depressed. They suffer from depression. It also decreases their quality of life. You just can't have the right quality of life if you're constantly in one pain or the other. Maybe headache, you suffer from headache. Maybe your own pain is headache all the time. It affects your quality of life. It causes what we call invisible disability. That means you have a disability, but it's invisible. It's not like you have a broken hand or amputated leg. So you're complete in your body, but you're in pain all the time. So that's an invisible disability. So you're actually disabled, but it's not visible. So there are all sorts of pains in women. There's muscle pain. called myalgia. Okay, so muscle pain is often caused by tension or overuse or hormonal problems. So overuse, for example, a woman came to me about constant pain in her hands and wrists and arms, constant pain. And I asked her what she does, her occupation, and she said she's a typist. So she's constantly using her fingers, using her arms to do her work. So that was causing overuse muscle pain. Another lady works in one of the big supermarkets, and that constant moving things to scan and pass that way, that movement was actually, the pain was from her occupation. So there's overuse kind of pain that causes muscle pain. There's also joint pain. So joint pain is another type of pain, okay? And it's common in women, especially the knees, the hips, and it's often worse as you get older. You start having wear and tear in those joints, and they cause significant amounts of pain. And also it gets worse if you get heavy. So the heavier you are, you add more weight, then you have more joint pains. So another type of pain is back pain. Back pain is so common, and I've experienced this myself. One day I went for a program in another city in Edinburgh, and when we got to that city, so I went by train. I was in the train for 2.5 hours, seated. When I got there the next morning, I could hardly even get out of bed to go for the course I went for because my back was so sore. And the only reason that had happened was the long train journey from my place to Edinburgh. And that, because I sat down throughout that journey, my back just seized, just went into spasm. So back pain is a common one. It's common in menstruating women. People on their periods experience a lot of back pain. People who are pregnant women get a lot of back pain. And those who lift and carry often. A lot of people come to me with back pain, and I ask them what they do. They say they are cleaners. So the sort of work you're doing can impact that bending over. If you haven't learned how to bend properly, you can be left with chronic back pain that can affect you for life. Okay, so welcome to you. Thank you so much all for joining. Okay, so another type of pain is neck and shoulder pain. Neck and shoulder pain. In this our times, we are prone to sitting on our tablet. Your neck is bent. Do you know that your head is about 3 kilograms in weight? So your neck, you can imagine your neck carrying a head that is 3 kilograms, bent like this. We often bend over our devices, bent over our phones, and so on. So you can imagine, no wonder people have neck. We're seeing a lot of young people actually having neck pain just from being bent over on their tablets, on their phones for long periods. So neck and shoulder pain is often linked to your posture. Some people sit so badly when they are sitting, they are slouched in the chair, or they are leaning too far back or too forward. Your chair needs to be able to support your back. When you're seated, your chair has to support your back. So we're seeing neck and shoulder pain also linked to stress. When you're stressed, without knowing it, the muscles around your neck and shoulder tense up. They tighten up when you're stressed. So that leads to chronic shoulder and neck pain. Another sort of pain is fibromyalgia. Have you heard about fibromyalgia? It's a common pain in some women. So fibromyalgia is a chronic condition. That means women suffer it for many years. It affects mainly women. It causes widespread pain. You feel pain in different parts of your body. You feel fatigue. You're easily tired. You don't know why. You also feel your brain isn't working, like you have brain fog. It's a condition called fibromyalgia. So it's good to get that checked out so you know whether you have it and what you can do. Another sort of pain is headaches. Headaches and migraines. Headaches and migraines. And it's often hormonal for women. You might find that you have more headaches during your periods, the week leading up to your period, you have a lot of headaches. And then after your periods come and go, the headaches subside. So that means it's hormonal. Your hormones are causing the headaches. Okay. Also, pelvic pain, there's pelvic pain. Some people experience chronic pain between their legs or in their lower tummy. So lower tummy pain or pain in between your legs can be pelvic pain. So it can be caused by menstruation, menstrual periods. There are people that when their period starts, they can't function. As in for the next 2, 3 days of their period, they are debilitated, they are home, they are in bed, they can't do anything. That's chronic pain. There's also pain that may be coming from a condition called endometriosis. So endometriosis is a condition where you have tissues of the womb in other places apart from the womb. So the tissues of the womb should just be in the womb. They should just be there to produce blood, for you to have a period. But you find that some of these tissues may be inside the actual muscles of the womb itself. So you can imagine if they are producing blood in those places, they are trapped. They can't come out. So it's a condition called endometriosis. And that can be a reason why you're suffering pelvic pain, pain in your pelvis, in the area in between your hips. That area is your pelvic area. And other reproductive health conditions can also cause pain, can also cause pelvic pain. So what about different pains in women? Let's look at some of the causes. Why do I have this pain? Why is my body always sore? Why is it that I feel like an old woman, even though I'm just in my 30s, I'm in my 40s? What's wrong with my body? Why is my body not functioning well? So, number one cause for a woman can be hormonal fluctuations, okay? Now, the female hormone estrogen helps us to tolerate pain. Estrogen helps us to tolerate pain better. Now, when you get to menopause, when your estrogen level drops, you're going to find that your pain tolerance drops, okay? You tend to perceive pain more when your estrogen level is low, okay? So hormonal reasons could be why you're having aches and pains, so it's important to check that out. Another reason could be stress and anxiety. Like I said, when you're stressed, your muscles tighten up. So you can imagine your muscles in a constant state of being tight, being in tension. Your muscles are tense. That is going to cause chronic pain. When your muscles are tense, you are actually in a state of inflammation. Inflammation is like tiny fires. It's like you have fires in your body. That's what tiny fires, like that's what we mean by inflammation. And that can happen during stressful times. Your whole muscles are tense. You're in this flight mode. You're afraid or you're very worried about something. Your muscles are all tense. Muscles of the scalp tighten up, causing headaches. Muscles around the neck, around the shoulders, they all tighten up during stressful times, and all that can contribute to pain. Another reason is poor posture. We've talked about posture. You must learn to mind your posture, especially now that a lot of us, our work is sedentary. My work is sedentary. I'm seated talking to patients all the time. So I have to learn to get up. I have to get up and move. So if your work is a desk work where you're always at the desk, you have to get up and move. Make sure every 30 minutes you're up and you're moving. Also, our sedentary lifestyles, because a lot of us are on our phone, we are flipping things on our phone. Our neck is bent, that causes neck strain and shoulder tightness, that leads to chronic pain. So poor posture and sedentary lifestyle is a common cause of pain. Now, another one you may not have thought about is poor nutrition. Nutritional deficiencies. For example, if you're lacking vitamin B12, you might find that you experience aches and you're unusually tired. If you're lacking vitamin D, that's another one that can make you feel achy and you feel tired. Things like iron, you're anemic, you have low magnesium, all these lack of vitamins can contribute to body aches and pains. So this can be checked with a blood test. So if you're getting a blood test, you can say to your doctor, could you please check my B12? B12 is a good one to check. Could you check my vitamin D? That sort of thing. Let them check and make sure you're not deficient in these vitamins so they can be corrected. Another common cause of your aches and pain is poor sleep. A lot of women do not sleep well. If you're not sleeping well, that will worsen what we call your pain perception. That means Even pain that you could have tolerated, you find it more difficult to tolerate that pain simply because you've not been sleeping well. So poor sleep leads to increased ability to feel pain. Okay, so that may be all you need to adjust. Get more sleep, you find that your aches and pains will reduce. So a common cause of pain in women is poor sleep disorders. You're not sleeping well. And I have a whole video, I think about 2 or 3 videos on sleep, just how you can get better sleep. Please watch them on my channel and you will find how you can get better sleep. Another common problem, another common cause of pain in women is autoimmune diseases. Now, autoimmune diseases are conditions where your own body, your own defense mechanism, that's your immune system, is attacking you. That's called autoimmune disease. Things like rheumatoid arthritis. So in rheumatoid arthritis, your own defense mechanism is attacking your body. So that causes a lot of pain. Okay, so that's a very important thing to check with your doctor because it's common in women. You have lupus. Lupus is an autoimmune condition. You have rheumatoid arthritis and so on. So welcome. I see Stella Maristuru. Hi to you. Welcome. Welcome to the chat and NSKPO. Yeah, I see you there. Well, welcome. Thank you so much for joining the chat. Please like the live stream. Just tap on the screen for me, like it, and send the link to someone if you're enjoying it, okay? We want to stop normalizing pain because it really affects a lot of women. Okay, so another reason for chronic pain is some infections. There are some infections you have and it leaves you having pain all the time. For example, we know some people who suffered COVID during COVID, they are now left with what we call long COVID. That means they are now experiencing constant pain, chronic pain, and other symptoms because they had the COVID infection. Some types of flu, you might have a flu infection, you're runny nose, cough, what seemed like a mild flu infection, but you're then left with body pain after that. So that can be a cause of body pain that people haven't even thought about. You've not realized, if you look back, you see that those body aches and pain started after you had your COVID infection. Okay, another common cause of body aches and pain is medication. Some of you are on some medicines that are causing body aches. It's really important to have a look at your tablets, see if there are any new ones you started that you can date your pain from. Now, a common cause of body pain, a common tablet that causes that is tablets called statin. Statins are used to lower your cholesterol, okay? They are quite good for bringing your cholesterol down, so they are good tablets, but they have the side effects of body aches. So I've had people come to complain, I'm constantly sore, my body is achy, I'm not sure what's happening, doctor. And then we look and we see that, 2 months ago, they were started on statins. So that may be what's causing their body aches and pain. Then we'll have to look at it, see if we can swap it for something else. But please don't stop your medicines without discussing with your doctor. If you think it's your medicine that is contributing to your body aches and pain, then speak to your doctor and let them see if there's something they can swap it for. But don't stop your medications without talking to your doctor. Okay, so another cause of pain is overexertion or injury. I have a few women who are in relationships that are abusive, domestic violence situations. When you've been slapped, there's a slap someone can give you and it leaves you with chronic jaw pain. I have a lady with chronic jaw pain just from slaps she had received in the relationship. So there are women in domestic abuse situations, of course, for men as well. There are men also in domestic abuse situations, but this is women's health. What we are saying is that you can have chronic pains and aches from injury in that sort of situation. A blow to your tummy can leave you with constant abdominal pain. A blow to your face can leave, so those sort of injuries can leave someone with chronic pain. So that's another cause of pain. So let's look now at the treatments. And if you're in the chat and you're suffering from pain, what sort of pain do you experience? What part of your body? And what have you done to make it better? Have you had some treatment? Type into the chat, or you have a question about your pain. Someone says, I feel ache on my right side of my hip, aches on my head, and upper back shoulder. But she said it's better now. Is that what you mean? That the pains are better? Okay, yeah, so that's a common scenario. Women come in saying they feel aches here, they feel aches there. So we want to talk about the solution. Let's have, I'm just checking in case there's any other question. So let's look at the treatment options. What can you do about your chronic pain? You're fed up, you're tired of your pain. It's limiting your ability to move around, is limiting your quality of life. Some can't even have sex because their hips are so sore. You know, when you lie down in bed, you just can't do anything. Your body is achy. You're looking after your children, your body is achy. What can you do? Okay, so I'll start with lifestyle intervention because I'm a lifestyle medicine physician. So my big focus is on lifestyle change. But I'm also a family physician, you see. So I know there's a place for prescribing medication. Okay, but let's start with the lifestyle changes you can make. First of all, the first thing there is exercise. You've got to start a form of regular exercise that will loosen up your body. Some of our bodies are so stiff. It's like a car. If you don't use a car for long periods, the car is going to, it's going to start getting rusty. The batteries may run down, you start having one problem or the other simply because it's not being used. The same thing with our bodies. If you find that your body is stiff, your body is tight, you do one little thing, you get injured, you do one small thing, it means you need to loosen up your body. You need to start some form of regular exercise. And it doesn't have to be gym. Please don't feel you have to go to the gym. There are things you can do in your own home. And the simplest form of exercise, like I said, is walking. Everyone can walk. At least most people can walk. Get up, walk around your neighborhood. Walk around your neighborhood a few times. Walk around, but walk fast. If you're walking fast, that counts as exercise, okay? So if you have body aches and pain, the first thing to do is to start some form of regular exercise so you can loosen up your body, okay? Things like walking, swimming. If you're near a swimming pool, I can get to one. That's a good one to do, okay? Swimming is very good exercise. It helps to improves your circulation and it reduces stiffness. So start from some form of regular exercise. Also do some weight training. Women, you have to lift weights. I have lots of videos on that. Lift weight, women, okay? When you lift weights, you're building your muscles. It reduces the tension in your muscles and it supports your joints better. We all have joints, but these joints are surrounded by muscles. So when we build the muscles around the joint, we're supporting the joint better. The joint will function better, okay? So the first step is some form of regular exercise that will reduce your pains and aches. The other thing is sleep. Sleep, like I said, if you don't sleep enough, you're likely to have aches and pains, okay? So improve your sleep. Aim for 7 hours of sleep every day without fail. Try and make it something you don't negotiate with. Don't joke with your sleep. Even if you have to, make your room inviting for you. Buy lovely bed sheets, invest in good pillows, make your room inviting so that you come in, you want to sleep. You want to lie down in that bed. Okay, make sleep something you don't joke with, something you really understand that your body needs. That will reduce your aches and pains. Now, the third thing to do is look at your nutrition. If you eat lots of sugary stuff, you're causing more inflammation in your body, so you're going to be prone to aches and pains. Okay, so look at what you're feeding your body. Reduce sugary food, reduce excessive salty food. Even those two things will immediately reduce inflammation in your body, and that will reduce your body aches and pain. The other thing is to eat foods that are anti-inflammatory, foods that can fight inflammation in your body. Things like leafy greens, okay? Lots of leafy greens. Your berries are also good. These help. Nuts are great. These are anti-inflammatory foods that help your body to fight inflammation and reduces body aches and pains that you're experiencing. The other thing is to stay hydrated. Women are really bad with drinking water. You have to love water. Take water as one of your best friends. Drink water. Make sure you take about 1.5 liters or up to 2 liters of water within a day. Drink more. The more you drink, you also find that you eat less. Especially for women who are trying to manage their weight, drink more water. Your body craves your water. Your body loves water. Drink more. Okay, what else can you do for your body aches and pains? What else can you do? Manage your stress. We have said that stress causes muscle tension. It tightens your muscles and leads to pains and aches. So manage your stress, whatever it takes, whether it's breathing exercises, meditation, meeting up with friends and family, doing things that make you happy, making some time for yourself, some me time, whatever it is that helps reduce your stress. Please do that. You will find that that will improve your body aches and pains as well. Okay, you can join a support group. Some people thrive very well in a support group. You can even go for counseling. If you're struggling with your mental health, go for counseling. Okay, don't feel that, oh, some people say, I don't want to go, I don't want to start telling all my problems to this stranger. The stranger is a professional. They are trained to listen to your problems and help you out. So please see a counselor, see a psychologist, manage your stress, because when you do, you'll be reducing your aches and pains. Okay, so the other thing is to make sure you watch your posture. We've talked a lot about posture. And for those who are just joining, please go back and watch all the beginning bits so that you see where we're coming from. Posture is really important. Bad posture is a common cause of body aches and pain. A lot of people don't walk straight. When they are walking, they're slouched or seated, they're slumped over. You have to have good posture so that it can reduce your body aches and pains. Also, take breaks from your screen. Like we said, the head is about 3 kilograms and is being supported by the neck. So you can imagine your neck supporting your head of 3 kilograms. If it's always bent, you're bent over, reading something, watching your tablet, then that neck that is carrying the neck, this neck carrying the head, is going to start having, you start having neck pain. You start having pain in your neck, and the neck pulls on the shoulder. So you have pain in all that area. So good posture is really important. If you manage that, that will really help your pain. If you're enjoying this program, please click the like. I appreciate if you click the like, share the link, okay? And we'll be back to talk about other women health issues. So feel free to subscribe and stay connected. Now, what else can you do about your posture? You can use a lumbar support. Some people find that no matter the chair they use, their back is not supported. I always have to put a wee pillow because I don't like my back just hanging. I like it fully supported. I like my posture to be upright because it helps me to reduce pains and aches in my body. So look for lumbar support. Adjust your screen height. Make sure your screen, like this thing I'm doing now, is at my eye level, okay? I can see the camera is at my eye level. Don't come and use something that you have to look down. Your screen is down or your screen is up, so you're looking up. Try and make sure that your screen is at eye level. That will help support your posture and reduce body aches and pains. Okay, the other thing is to do a massage, go for a massage. And a lot of people don't understand that massage is so important. I remember I told a lady who said her body was all achy. They had done blood tests. There wasn't anything they were finding. I said, go for a massage. Go and pay and get a massage. And she said that while she was there, once they started, in fact, after a while, she heard this heavy snoring. I think I've told this story before. Someone was snoring so heavily. So she actually woke up because of the snoring and realized that she was the one snoring because it was only her and the massage person in the room. So immediately they started working on her muscles, releasing the tension in her body. She just fell asleep, That shows how much she had been carrying, how much pressure and tension that was in her body. Her body was tight. We need to loosen up our bodies, okay? So go for a massage. That will really improve. It's really good for people who have chronic pain. It will reduce the tension in your muscles and it will increase the blood flow, get your blood flow properly. Okay, so let's now talk about the medical bits. Like I said, even though I'm a lifestyle medicine physician, I'm also a family physician. So we do, look, we do use medications as well. So number one, what can you use? Anti-inflammatory tablets. So anti-inflammatory tablets like ibuprofen, naproxen, these ones also reduce the inflammation in your body and help with your body aches and pains. But be mindful if you're taking them, the anti-inflammatory tablets can make ulcers worse. Okay, so if you're prone to ulcers, please don't take them. If you're allergic to them, don't take them. If you have asthma, some asthmatics can take anti-inflammatory tablets. So please be mindful, check with your doctor if you're taking anything. But anti-inflammatory tablets like ibuprofen are very good for body aches and pain. We wouldn't want you to use them forever and ever. The reason we give some medication is to get you started. There are some people who need to move, who need to exercise, but they can't move their body. They're too sore. They're in so much pain, they can't move. So we have to start from somewhere. We give you medication. We hit the pain with some medication so that you're pain-free enough to get up and move. So it's not for you to be using the medicine all the days of your life. It's to use it enough to get rid of some of the pain so you can start moving, put in some movement. Some people say, I'm too sore to move. I tell them, take some pain relief so that you're relieved enough to be able to start moving, and then carry on from there. So what else can you do? If you have autoimmune disorders like rheumatoid arthritis, there's treatment for it. You can't cure it, but it can be treated. So it needs to be assessed by a specialist. Make sure if you have autoimmune diseases causing your chronic pain, see a specialist, okay? See a rheumatology doctor so they can give you the right treatment for your autoimmune condition. We talked about supplements, okay? When you do the blood test, your B12 is low, your vitamin D is low. Please take the supplements, replace these things, they make a difference, okay? The other thing is acupuncture. I had a lady with really difficult to manage headaches. She had tried a lot of things for headache, but then she did acupuncture and her headaches were so much improved. So they do help, okay? But if you're doing acupuncture, make sure it's a licensed person and they know what they're doing. Make sure you get good reviews from people they've treated, but by all means, that can be an option for your chronic pain. Okay. The other thing, another form of treatment is hormonal treatment. Hormonal treatment. Like I mentioned earlier, if your pain is due to your periods, maybe you have periods where there is, for example, you have a lot of pain before your periods appear, that may be a hormonal thing. So it might need to be tackled with hormones. There are tablets, hormonal tablets you can be given that will help your chronic pain. Okay. So go see your doctor and get some treatment for your chronic pain. So how do we then prevent this? Supposing you're listening and you're like, oh, I'm so glad I don't have any pain. I don't want to have any. How can you prevent yourself? Like I said, 60% of women have chronic pain. So if you don't take active steps, it's very likely that it might get to you because it's 60% of women that have chronic pain. So how can you prevent it? Number one, stay active. We've talked about this a lot. You have to have some form of movement, daily movement. I am busy at work and sometimes I don't get a chance to move around. But once I get home and have my dinner, I put on my walking shoes. I am out of the house immediately. I walk around the neighborhood. I walk, fast, short steps. I walk around. That's my form of exercise because I'm busy during the day doing other things. Occasionally I have time. I go to gym. I love to go. I love the group classes. I go for the group classes and so on. So those are all good, but don't limit yourself. Don't say because there is no gym or I can't get to a gym. No. Walking is fabulous exercise, okay? So stay active, rest enough. We talked about sleep. Listen to your body. If you're feeling stressed, if you are so engaged, try and disengage yourself from some of your commitments, okay? There are some, you can't do everything. You have to listen to your body. If you break down, someone else will have to do that thing, isn't it? Yeah, life will go on if you're not there. So take a break. When I know I have a busy time coming, there are sometimes I work, some weekends I work, I know that in the week leading to that weekend, I'm going to take it easy. Why? Because I have a busy weekend coming. So learning to listen to your body, learning to make sure you're not overcommitting yourself is quite an important self-care thing to do. So try and do that, okay? Number 2 is to keep a pain diary. Keep a pain diary. Become a specialist in your own pain. Become a specialist in your own body. Understand what makes you sore. What is it that makes your body sore? Understand what it is you do that brings on pain. Understand what it is you do that makes things better. Become an expert in your own body. Okay, keep a pain diary. When something you do, you wake up the next morning, you're very sore, then look back, say, what did I do the day before that's made, write it down. Keep a pain diary. Before you know it, you would have understood the ins and outs of that pain, and you'll be able to prevent it happening. Okay, so look for your triggers and what causes improvement. So don't normalize pain. Seek help early. Okay, let's seek help early. Try to find out, why am I having this constant pain? So I hope this has been useful for us. I think we'll call it a day here. Please let me know in the chat how you found this talk. Was this useful? And we'll do some other women health topics too. So please subscribe and type in something in the chat. I want you to tell me what kind of pain you've been experiencing, and if you picked up 1 or 2 things that can help you with that, please share the link. Please subscribe if you're not subscribed, and I'll see you back in my next video. I just want to make sure there's no question I have missed. Thank you so much for everyone who tuned in. It's been lovely seeing you all. Thank you, and I'll see you back in my next video. Bye for now.